does bracing actually work for scoliosis? If your child has recently been diagnosed with scoliosis, I know this can be one of the most overwhelming moments as a parent. You're probably feeling a mix of worry, confusion, urgency, and one of the first questions that comes up is one, does my child need a brace? And if so, will it actually work? Now, there's a lot of mixed information for bracing and scoliosis. Some people say that bracing doesn't work, that people will still end up needing surgery. Some people say that it can potentially stop the curve, but it can't reduce the size of the curve. And yet other people say that scoliosis bracing may reduce the size of the curve in some cases. So with all this different information out there and contradictory information, how do you know what to believe? Hey, my name is Dr. Chris Gubbels, leading authority in the non-surgical treatment of scoliosis. And today I'm going to walk you through exactly what scoliosis bracing is, how it works, the benefits, the limitations, and most importantly, how to make the best possible decision for your child's health and future. I've seen firsthand both the successes and the frustrations and the failures. And when it comes to scoliosis bracing, my mission is to help patients cut through all the noise, avoid common pitfalls, and make sure you choose the right path forward for your child. Now, if you haven't already, be sure and click on the link below and get our free guide called the 4 Crucial Factors to Choosing the Right Treatment for Your Child. Now, all big curves start off as small curves. And the number one reason people end up getting spinal fusion is delayed and inappropriate treatments. You see, there's this window of opportunity for the most effective treatments. And when that window is gone, the opportunity for the best possible outcomes, unfortunately, is also gone. Now, our mission at ScoliCare is to help our patients get the right treatment at the right time. So let me show you a story about a patient who did not get the best treatment at the right time and what that looked like for her. So this is our patient, Katika, and Katika's mom noticed that something wasn't right, and so she brought her to her pediatrician. The pediatrician realized that she probably had scoliosis. So she was referred to an orthopedic pediatric doctor, where they found she had a 13-degree curve. This was in July 2020. The doctor said, it's not likely to progress, but we're going to do a checkup in 6 months and see what's going on. So she had her come back in 6 months, and at this point, the curve had progressed to 23 degrees. However, even though the curve had progressed 10 degrees in just 6 months, the orthopedic doctor said it wasn't a concern and she didn't expect it to progress anymore. Anyone that's really skilled at conservative management of scoliosis knows a curve right here at 23 degrees when she's just starting her growth spurts. We know that based on where her growth plates are. This curve has basically 1,000% likelihood of progressing without any kind of treatment. But she was told that she didn't need to do anything, not really a concern. They came back and almost a year and 9 months later, and at this point the curve had progressed to 30 degrees. Now, a 30-degree curve when someone's done growing, or a higher likelihood of continuing to progress even when someone is done growing. But again, she was told she's getting near the end of her growth and it's not really a concern, and there was no treatment that was needed. Well, some time went on, a few months went on, mom was still concerned, and that's when about 10 months after this initial one, she brought her into CS, and her curve had progressed from 30 to 45. Again, this is a pretty easy to predict it's going to keep progressing if you're trained and really skilled at the conservative management of scoliosis. At this point, she's actually candidate for surgery and recommended for surgery, but the parents were still looking for non-surgical treatment options. And a little bit later in the video, I'm going to go over what we were still able to do for her outside of surgery, even though we had missed that critical window of opportunity. As I mentioned before, there's mixed information on research. Some research shows that bracing doesn't work, some that it doesn't. Let's take a look at this, and then I'm going to explain why you hear different information out there as far as what bracing can or cannot do. So here's one paper that was published in the Journal of Pediatric Orthopedics in 2007. And in this paper, when they're looking at this certain brace called the Providence brace, they said that 79% of the patients, the teenagers that got a brace, still ended up having surgery. So their conclusion was that bracing's not really effective at preventing surgery. They don't really work. However, in 2013, a landmark study was done and published in the New England Journal of Medicine, one of the most prestigious journals out there. And this is an interesting study. They had 242 patients. Some were randomized, meaning they were either given a brace or they were pre-elected to not get a brace, and some had the option to choose if they wanted to have a brace or not get a brace. And they were looking to see if they could reduce the likelihood of the curves progressing to surgical levels. Well, interesting enough, partway through the trial, the study, the ethics committee actually stopped the research or stopped the project because it was so evident that bracing was effective in preventing surgery. It was considered unethical for the people not getting a brace to not have the chance to get a brace. And they said that the treatment rates there was a 72% success rate of someone not ending up having surgery if they wore a brace. So the study before showed that pretty much everyone ends up getting surgery. This study showed that the majority did not get surgery. Also note, in this paper, they didn't say anything about if they could potentially reduce the size of the curves. This is what's interesting. In the most orthopedic world, they say bracing may slow the progression of scoliosis or prevent surgery, but they say that you cannot reduce the size of the curve. This is actually from a video from Children's Hospital, and they say wearing a brace does not make the curves smaller. But let's look at some other information. But this is a pilot study done by ScoliCare using the Scoli brace, and it was done in Singapore with adolescents that were going through growth spurts, and it had moderate to large curves. And in this study, 54% of the patients actually had a reduction in the curve, or they actually had an improvement in the curve, meaning we reduced the size of the curve in the majority of the patients. 87% of the patients remained under surgical levels, and we had surgical levels at 45 degrees for this, but none of the patients actually progressed to 50 degrees. So we had better results than the brace study that I previously talked about. We also noticed is that people that had increased number of hours wearing the brace were associated with the greatest results. Now, this was done at a hospital in Singapore, which was very hot, which is one thing that affected the compliance. So in this study, when you look at the monitors showing how much people wore the brace, the ones that wore the brace the most amount of hours are the ones that had the best success and the best reduction in the size of the curve. Now, in the orthopedic world, again, the Scoliosis Society recommends doing bracing between 25 and 40 degrees. They say it's not really important to do that for smaller curves, and it's not really that important or ineffective to do it for curves over 40 degrees. But let me show you a research paper that actually shows what about people that are beyond that surgical threshold that are still refusing surgery and are looking for non-surgical treatment options, just like the patient Katika that I had just showed you. So this is a paper that looked at patients who were refusing surgery even though their curves had progressed to 45 degrees or greater. The curves were anywhere from 45 to 60 degrees, and the patients were doing bracing. And they found that when doing bracing full time, 71% of the patients, actually had a reduction in the size of the curve. Basically, it's saying that the brace treatment can still be effective in people that cross that threshold of 45 degrees, which is generally considered the cutoff for someone who becomes a candidate for surgery. So we know we can still effectively treat patients that have larger curves that are candidates for surgery if they do not want surgery. And we have evidence to support treating people with curves at least up to 60 degrees. Now let me go back to Katika and let me show you how her story ended. This is her when she came in to see us. She had a 45 degree scoliosis. This is her with her brace on, all right? Her curve reduced from 44 down to 12 degrees with her brace on. And this is her at 3 months with her brace off. And so she's not done with treatment, but we were able to reduce her curve from 45 degrees down to 25 degrees. So not only did she not have surgery, we actually reduced the curve size. And it's down to 25 degrees, which is really important because when you're done growing, curves over 30 degrees have a higher likelihood of continuing to progress and causing other health problems. So getting it below that 30 degree threshold is also really critical. So as I mentioned, one study showed that 79% of people progressed to surgery when braced. The brace study showed that 72% people stabilize and do not end up having surgery. In the pilot study done by Scoli Brace, I showed you that 54% of people actually had a reduction in the size of the curve, and 87% did not end up having surgery. And then the paper I showed you with curves between 45 and 60, that 71% actually had an improvement or a reduction in the curve. So why is it some research showing you that people get good results with brace and other research says people don't? Well, it really comes down to the actual brace. And so what we know is when someone is wearing a brace, we have to receive or see a reduction in the size of the curve with that brace on. And if a brace does not correct a curve on application, then either the brace has not been designed, manufactured, or fitted correctly, or the curve cannot be braced. So we have to see a certain amount of reduction with that brace on, and if we don't, either that brace is not made right, or that's someone that may not be a candidate for bracing. What we also know is if a brace is designed right and it gets good in-brace correction, someone still has to wear the brace. What they said is that those that had worn it at least 13 hours a day had upwards of 90% chance of avoiding surgery. So to recap what that means, there's two things we have to know for a brace to have a chance to work. One, we have to have a good in-brace correction. A brace has to be able to reduce the size of the curve with the brace on, ideally anywhere from 30 and a minimum of 30%. Now, if we do not get a reduction with the brace on, either that is someone's curve that cannot be effectively braced for treatment, or that brace is designed improperly. And I'm going to show you some examples of braces that were designed improperly. Now, if the brace gets good correction, then the patient still has to wear it. You can imagine if someone's wearing Invisalign in their teeth and they don't wear it consistently, they're still not going to get changes. So the brace has to be made right and the patient has to wear it. The great news is we actually have monitors now that we put in braces that tell us exactly how much someone wears the brace. A lot of times patients or parents don't really know. I'll give you an example. I have a niece that comes to me for treatment and she has a small curve, so we have her wear a brace just at night. And mom said, yeah, she wears the brace pretty much 8 to 9 hours every day at night when she sleeps. But when I checked the monitor, we found out she's only wearing the brace about 3.7 hours a day. So when I looked into the data a little bit further, I found out she has some nights where she wears the brace 8 to 9 hours, and other times she doesn't wear the brace at all. And what we discovered is sometimes she stays up and watches TV and falls asleep on the couch. And when she does that, she never puts her brace on. If she goes to bed, instead of watching TV at night, she puts her brace on. So now, when she comes home from school, we just put that brace on right away and she wears it until she wakes up the next morning. So we have to know if a person's actually wearing the brace. So another study looking at this, the effectiveness of compliance counseling on brace use and success in patients with adolescent idiopathic scoliosis. They said compliance monitoring and providing feedback about compliance with the brace monitor improves compliance. So having a monitor so we know how much they're actually wearing a brace and being able to counsel and give feedback to the patient and the parent is something we know definitely improves compliance. And patients with compliance monitoring often have better outcomes. Whatever you measure and report gets improved. So patients, when we actually use monitoring and we're using it to coach and counseling our patients, we know we get better results with those. So let me show you some examples of braces that don't work. This is the patient that has a big right thoracic curve. And her brace basically holds her curve in the incorrect position. Bad bracing gets bad results. A brace like this has zero chance to be effective. When you ask the orthopedic doctor why they designed the brace like that, he said it's really comfortable. But this is like someone wearing a retainer or putting brace on their teeth that actually holds their teeth in a misaligned position versus actually working to correct the alignment. The other thing I talked about is the amount of in-brace correction. So this is the brace that was actually made and manufactured by a local hospital, orthopedic center. First of all, it closed in the back, but this is very symmetrical. It's like a tube. With the brace on, the curve here is 17.5 degrees, and the one down below is like 26.9. With a different brace, an overcorrected brace like we use with the Scoli brace, we reduce those same curves down to 7.1 and 5.8. So you can see there's a much better reduction in the curve with an asymmetrical three-dimensional brace compared to a symmetrical brace that's typically used at a local hospital. So because of this, you're going to get two completely different results with these braces. Another great case. This was a patient, he was actually a juvenile, and he had a 27-degree lower lumbar curve and a 32-degree thoracic curve. They went to the hospital, they had made this brace. It's basically like a tube, just trying to squeeze and hold it like a cast. And he virtually had no change in his lower curve. That stayed at 27 degrees, and the upper curve reduced by about 11 degrees. So not very good correction up here and zero correction below. Parents weren't satisfied, so they came to ScoliCare. We made him an overcorrective Scoli brace, and that curve reduced from 27 to 3 degrees, and this one actually went from 21, or it was 32 down to 13 in the opposite direction. So much better in-brace correction, and this is him after 3 years. His curves end up being, this is with the brace on, 2 degrees and 12, but long term, he had a 15 and 14 degree curve. So we reduced this curve. This one down here below was 27 when we started, ended up being at 15. At 15, it's not really a concern when he's done growing. And this one up here, which was 32 degrees, is down to 14. So not only did the curve not progress, but we actually reduced the size of the curve. So not only did the curve not progress, but reduced the size of the curve. So with all that information out there, here's what it comes down to. One, different kinds of braces get different results. Poor braces get poor results, but great braces can get great results in the right cases. And not only can we reduce the likelihood of a curve progressing surgical levels, in many cases with the right brace, when worn properly, we can reduce the size of the curve. Now, if you're out there and you're a parent and you're watching, I know all you want to do is make sure you get the right treatment for your child. So one of the things you can do is click on that link below, request a free discovery call. That will give you a chance to talk to me one-on-one about you or your child's scoliosis. I'll let you know how severe it is, the likelihood of progressing, and what treatments you're a candidate for. And to learn more about the most effective treatments for scoliosis, click on our next video, and I'll see you there.